Good evening. My name is Raquel Womble, and my research topic is the correlation between diabetic patients and the development of auto brewery syndrome. My mentor for this research is Dr. Ackreiter. Before getting into what auto brewery syndrome is, it's important to understand the basics of certain processes that will pop up again when we get to auto brewery syndrome. The first one being glycolysis, which is the breakdown of glucose into two pyruvate molecules. And the purpose of this process is to generate ATP. Two pathways that can occur in glycolysis are aerobic or anaerobic. And here we have a diagram. Here is a glucose molecule that is moving into the cell. It's undergoing glycolysis, which will break that glucose down into pyruvate. Now, in the presence of oxygen, that pyruvate will make its way to the mitochondrion, where it will undergo oxidative phosphorylation. From that process, we get two compounds, FADH2 and NADH. Those products will go on to the electron transport chain and create 30 to 32 ATP molecules. Now, when pyruvate is not in the presence of oxygen, it can go under one of two types of fermentation. It can undergo ethanol fermentation, which is typically done by organisms like fungus, or it can undergo lactic acid fermentation, which occurs in humans. Now, auto brewery syndrome is a disorder in which intoxication occurs after digesting carbohydrates and without consuming any sort of alcohol. And the cause of this disorder is said to be the overgrowth of fungus in the GI tract and occasionally, very rarely, bacteria as well. There are two types of bacteria that were reported in one case, and those were Klebsiella pneumoniae and Enterococcus faecium. Now, there's two genus types of fungus or yeast that were found, that are typically found in these cases, and one is Saccharomyces cerevisiae and various species of Candida. Now, while auto brewery syndrome does not discriminate against anyone, it can occur in children, it can occur in men, women, young, old. It's most common in individuals who have a disorder that cause them to be immunocompromised. Now, this is a nice diagram that gives a good indication of what auto brewery syndrome is. And here we have a stomach full of carbs with beer and bread. And since the overgrowth of fungus occurs, that'll be in the stomach as well. And here is a yeast cell. So the yeast cell will feed on the sugar and undergo fermentation. And two things will come out of it: ATP and ethanol, which is also alcohol. It's the same alcohol that is consumed by humans. All right, now on to the basics of diabetes. Now, diabetes is a blood sugar disorder in which sugar cannot be properly metabolized in the body due to the lack of insulin. Now, insulin is secreted by beta cells from the pancreas, and it is a hormone that regulates blood glucose levels by directing glucose molecules into cells. There are two types of diabetes, and the first one is type 1, and we have a nice diagram here. Type 1 is where the pancreas is unable to produce insulin. So as we see here, there's no insulin in here. So because of that, the glucose molecules will just build up in the blood, causing hyperglycemia. They are not moving into the cells whatsoever. Type 2 occurs when the cells become resistant to insulin. So we see here that there is insulin here, but the cells are not responding to the signals of the insulin, and therefore the glucose is not moving into the cell. Now, the purpose of this study is to understand what factors make diabetics more prone than those of normal health to develop Brewery syndrome. And this is important to understand how to prevent the development of ABS. And in many cases, those with ABS or Brewery syndrome end up in the hospital due to car accidents because they are intoxicated after eating dinner or lunch or what it may be. All right, so the hypothesis for this study is that diabetics are more likely to develop Brewery syndrome than people of normal health due to being immunocompromised, and because those with diabetes are immunocompromised, they have a tendency to use antibiotics quite frequently compared to those of normal health. And as well as diabetics have a high sugar level compared to normal people, and they also consume more carbs. All right, so I will go over 3 different cases of patients who were admitted into the hospital for Brewery syndrome. Here we have a patient that was male, mid-40s, obese and diabetic, and he had recently had procedures done on his mouth, and because of this, he underwent 2 rounds of antibiotics. Shortly after, he developed symptoms of slurred speech, delusions, fainting after meals, seizures, vomiting, diarrhea, and he was rushed to the hospital. Once cultures were taken, it indicated that there was a growth of Saccharomyces cerevisiae, and the patient was treated with oral antifungal medications. And after a month after he left the hospital, he returned. And in turn, he was then given the diet of no carbohydrates. He could not eat carbs, and he was put on an IV which contained antifungal medications. And once he healed from that, he was fine. And over here is the fungus that was found in his culture the second time he went back to the hospital, and this is Candida intermedia. Case number 2, the patient was also male. He was mid-80s and diabetic. He had been helping his ill wife, and as a result, he admits that he had a poor diet and wasn't really taking care of himself. And soon after, he developed symptoms of aggressive behavior, vertigo, and his urine was white. So he was rushed to the hospital, and after some labs done on him, he had high blood sugar, and alcohol and yeast were present in his urine. doctors were able to quickly figure out that he had auto brewery syndrome. So he was given insulin and antifungal medication intravenously. And after 5 days of treatment, his condition returned to normal. All right, case number 3. This patient was also male, mid-40s, and diabetic. This patient had come in and he was having similar symptoms of slurred speech, just symptoms of intoxication. This patient initially was improperly diagnosed with pancreatitis due to alcohol usage. However, this patient had been sober for 20 years from alcohol. So this patient had also previously been on antibiotics, and after doing fecal swabs, fungal cultures were conducted on feces, and it was found that he had these lovely little guys in there. These are Saccharomyces cerevisiae. And he was treated the first time, but he relapsed, meaning that he became symptomatic once he healed again. And he came back to the hospital, and that is where he was put on an IV with fungus medication, antifungal medication. All right, so trends that we're seeing between cases is that all of these patients were diabetic. All of them had previously been on antibiotics, and all of them had some form of yeast present in their gut. Now, why would this happen? Well, low immunity in the body can cause low immunity is caused by high blood glucose levels or hyperglycemia, which results in inflammation. And inflammation within the body can actually cause immunity issues. All right, and then antibiotic usage is another issue as well, because antibiotic usage has a negative effect on the GI tract. While antibiotics are great for curing bacterial infections, it doesn't discriminate, so it can kill your good bacteria, your microflora in your gut. And with that gone, it can cause the overgrowth of other flora that are typically commensal, but they become pathogenic. And in this case, it's the yeast. All right, and then high carbohydrate intake. So sugars that are eaten in their dinner or lunch or whichever will feed the yeast and cause them to just grow uncontrollably. So conclusions that can be drawn is that being immunity deficient puts diabetics at risk for developing this condition, and antibiotic usage reduces GI tract colonies, which need to be at a certain balance to prevent the yeast from overgrowing and causing this condition. And then by reducing carb consumption, you can actually bring it back to a balance as well. And treatments for auto brewery syndrome include antifungal, as described in the cases where the patients were put on IVs. Probiotics help put good bacteria back into the gut and help bring it back to balance. And not eating carbs or a reduced amount of carbs will prevent the yeast from overgrowing and bring it back to a balance. And that is it. If you have any questions, please let me know, and thank you.